Which of the following is a typical clinical sign of aortic insufficiency in a pediatric patient? A. Exercise intolerance. B. Excessive sweating. C. Frequent epigastric pain. D. Mania. The answer is A. Exercise intolerance. Exercise intolerance is a typical clinical finding in pediatric patients with aortic stenosis. This condition may present with any of the other symptoms, but mania, excessive sweating, and epigastric pain are not directly associated with aortic insufficiency in this population. Parvovirus B19 causes which of the following conditions? A. Roseola infantum. B. Fifth's disease. C. Rubeola. D. Scarlet fever. The answer is B. Fifth's disease. Parvovirus B19 causes Fifth's disease, sometimes referred to as slap cheek syndrome, due to the bright red cheeks that often present with the infection. Scarlet fever is caused by group A streptococcus infection. Roseola infantum is caused by either human herpes virus 6 or human herpes virus 7. Rubeola, or measles, is caused by the measles virus. What is the incubation period for varicella, chickenpox? A. 48 to 72 hours. B. 14 to 28 days. C. 2 to 7 days. D. 10 to 21 days. The answer is D. 10 to 21 days. Varicella, caused by an infection with the varicella zoster virus, has an incubation period of 10 to 21 days. Which of the following infections is the most common cause of hand, foot, and mouth disease? A. Enterovirus 71. B. Human herpes virus 6. C. Parvovirus B19. D. Coxsackie virus A16. The answer is D. Coxsackie virus A16. The most common cause of hand, foot, and mouth disease in the United States is Coxsackie virus A16. Enterovirus 71 can also cause hand, foot, and mouth disease, though it is a less common etiology. Parvovirus B19 causes fifth disease, sometimes referred to as slap cheek syndrome. Human herpes virus 6 is one of two viruses that cause Roseola infantum. While doing a standard ophthalmoscopic exam on a 7-year-old female, the examiner notices that while the light reflex of the left eye is red, the light reflex of the right eye appears bright yellow. The right pupil is also less reactive to light, and the right eye appears to be slightly bulging. The examiner should be suspicious of which of the following conditions? A. Cataract. B. Hordeolum. C. Pincula. D. Retinoblastoma. The answer is D. Retinoblastoma. Retinoblastoma is the most common form of ocular cancer in children. It is derived from developing retinal cells. The most common symptoms are a white or yellow light reflex, also known as leukochoria, diminished pupillary reflex, crossing of the eyes, impaired vision, and bulging of the affected eye. A cataract may also cause the pupil to appear white or to produce a white or yellow light reflex, but it will not cause bulging of the eye. A pincula is a fatty deposit on the sclera which will not alter the red light reflex, and a hordeolum is outside the eye itself. It is an infection of a hair follicle of the eyelid, also known as a sty.